Let's play
Coronavirus outbreak.
Let's go for it! Gloves!
check,
Hats!
check.
Underwear! 12 seconds later.
Coronavirus. You have probably heard about it by now. The most recent statistics indicate around 125,000 people infected and around 4,600 people dead. A lot of people are worried, justifiably so, but a lot of people are stoking panic, in my opinion, unjustifiably. I thought I would put forward this case for worry, but not panic, at least not yet. It's worth noting I'm not a medical expert, nor am I privy to any exclusive information. Before moving on, coronavirus COVID-19 was just listed as a pandemic by the World Health Organization, which prompted yet another wave of mini panic. First, I will critique the WHO speech to this extent.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly.
I am curious, could anyone find any past precedent for the inaction of nation-states being used as the justification for deeming something a pandemic? I have not yet found one, but putting that aside, I think pandemic is a warranted label in this case. The problem is that much of the media will not give you the full context of this term. Here are the currently listed pandemic and endemic ailments on the World Health Organization's website. You probably haven't heard of a lot of these pandemics, yet they made the list before coronavirus. On to the virus itself. Starting with the best case study we have so far, in my view, the Diamond Princess cruise ship. 3,711 people on board, around 700 infected, 7 deaths. Assuming everyone was exposed, that's a 19% infection rate and a 0.2% death rate. If you extrapolate from this to the global population, assuming everyone was exposed, you would have approximately 1.463 billion people infected and 15.4 million dead. Those are big numbers, potentially scary numbers, but they're also lower than the lowest estimates for the Spanish flu. The global population at that time was 1.8 billion. Estimates vary, but around a quarter of the globe was infected, and between 1 and 6% of the human population died of Spanish flu in the span of 2 to 3 years. We made it through that. But it's also worth noting that a cruise ship is not the planet Earth. Cruise ships skew to higher ages. Cruise ships are something of an incubator for viruses. They are densely populated compact spaces, filled with alcohol and seasickness, which tend to weaken the immune system, and they are germ galore, and there's nowhere to go. On the flip side, the Spanish flu hit during the First World War, and there wasn't a global response for around 6 months. Even then, technology was limited and logistical lines were more difficult to establish. One could also posit that sentiment toward vaccination was more ambiguous at that time. So, taking the Spanish flu for comparative analysis, coronavirus seems to be less infectious and less lethal. That is a positive sign. The world is more globalized. This makes the spread easier and containment more difficult, but it also hastens the search for and distribution of a potential vaccine. A neutral sign. There isn't a world war taking place, good sign. We are less than 6 months into this, and the global response is much more apparent. One could argue that wide-scale quarantines, as in Italy, may end up doing more harm than good, but we cannot say for sure at this juncture. Mostly a good sign. Here is the caveat, though. There was more than one wave of Spanish flu, and the second was far more lethal than the first. That's the main source of worry to me. Anything I or anyone else has said about this virus is subject to change given certain mutations. But still, we know what the past looks like, and we're in a better position to respond effectively this time around. We have SARS, swine flu, and many other ailments in our past to look toward. It's worth worrying about, not worth panicking about. Not yet.